Cushing syndrome is a disorder of the endocrine system. There are several conditions that can cause Cushing syndrome, but its underlying cause is chronic exposure to corticosteroids. About 85% of cases are due to Cushing's disease, which is an adrenocorticotropic hormone secreting adenoma. It can also be caused by administration of exogenous corticosteroids such as prednisone. Cushing syndrome occurs when the body makes too much cortisol. Those that suffer from it can have the following signs and symptoms. Upon inspection, the client generally has thinning hair, acne, red cheeks, rounding of face also known as moon face, and fat deposits on the back of the neck and shoulders also known as a buffalo hump. They often have truncal obesity characterized by a supraclavicular fat pad, increased body and facial hair, weight gain, purple striae, and a pendulous abdomen. Signs of this condition include thinning of the extremities with muscle atrophy. They have ecchymosis resulting from easy bruising, thin skin and subcutaneous tissue, and they often have slow wound healing. Clients that have Cushing syndrome may also have hypervolemia, hypertension, edema of lower extremities, inhibition of immune response, and suppression of allergic response. They can have hyperglycemia and dyslipidemia. Patients may have changes to their mood and mental status with symptoms such as euphoria, irritability, depression, insomnia, and anxiety. For diagnosis of Cushing syndrome, there are 3 tests used. A midnight or late-night salivary cortisol test is completed to test for cortisol levels in the blood. If the results from this test demonstrate elevated cortisol levels, then this is followed by 24-hour urinary-free cortisol test and a dexamethasone suppression test. Urine cortisol levels higher than 100 mcg, 24 hours, are indicative of Cushing syndrome. The dexamethasone suppression test will show the interactions of the hypothalamic-pituitary-adrenal axis. This test is completed to find the cause of excessive blood cortisol levels.